Hi, thank you for joining us tonight for Fatigue and Sleep. This webinar series is brought to you by Can Do Multiple Sclerosis, the National Multiple Sclerosis Society, and the Multiple Sclerosis Society of Canada. My name is Krista, and I'm the Programs Manager from Can Do MS and will be your moderator this evening. Can Do MS delivers health and wellness education programs to help families with MS thrive. Please visit Can Do MS's website, cando-ms.org, to learn more about Can Do MS programs. The mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. You can explore other society programs, services, and resources at their website, nationalmssociety.org. We will save about 20 minutes at the end of this webinar for a question and answer session. If you have a question during the presentation, you can type it in the Q&A pod found at the bottom right of your screen. I encourage you to all participate and be part of this interactive discussion. The presentation is also being recorded and will be archived on the Can Do MS website. You can download a copy of tonight's presentation and additional resources in the Files pod. You will also be able to access these resources in a follow-up email that will be sent out tomorrow. Our speakers this evening are Abby Hughes and Stephanie Singleton. Dr. Abby Hughes is a clinical psychologist and an assistant professor of physical medicine and rehabilitation at Johns Hopkins. She specializes in rehabilitation psychology and MS rehabilitation. Thank you for being here tonight, Abby. And Stephanie Singleton is an occupational therapist with over 30 years of experience. Her passion is providing education to people living with MS, their support partners, and other professionals on how to live their best life while living with a chronic disease. Good evening, Stephanie. Thank you both for being here. Now, it looks like most of the people on the call this evening are persons with MS. It does look like we have a few support partners joining us as well as couples joining together. So that's great. Thank you. It also looks like we have about, let's see, 65% of people tonight that have experienced sleep and fatigue issues over the last year, at least 51 to 700% of the time. With that, I'm going to go ahead and hand the presentation off to our wonderful speakers this evening.
Good evening. The learning objectives for this webinar include define and describe sources of fatigue in MS, describe the types of sleep problems most common in MS, describe the relationship between sleep and fatigue in MS, compare basic tools for assessing fatigue and sleep disturbance, and implementing a few strategies to manage fatigue and sleep disturbances. In this section of the presentation, we will define and describe the sources of fatigue in MS. As defined in an article that was in the Multiple Sclerosis International Journal, fatigue is a subjective lack of physical or mental energy that is perceived by the individual or caregiver to interfere with the usual and desired activities. According to the National MS Society website, almost 80% of patients with MS report fatigue in the first year of disease onset. Fatigue is a highly prevalent symptom in the early stage of disease, with 55% of patients describing it as one of the worst symptoms they experience. With advancing disease progression, that number increases to 95% of patients reporting fatigue. As you can see by the results of our pre-polling question, that in the last 12 months, well over 60% of you have frequently or consistently had difficulty with fatigue and or sleep issues. So, fun fact, can you believe that at one point many years ago, the medical profession used quote-unquote, the hot bath technique to diagnose MS. They would put the person that was suspected to have MS into a tub of hot water, and if the neurological symptoms got worse, they would say that person had MS. As many of you know, the diagnosing for MS has come a long way since then, but it still can be difficult to diagnose.
So we'd like to start with talking about some of the main sources of fatigue. I could see even in the chat window several people asking questions about how do you know if it's MS-related fatigue versus something else. And the short answer is it's complicated and it depends because MS fatigue can be caused by so many different factors. Neurologic fatigue is something that people with neurologic conditions often experience, and it's a direct consequence of the nerve damage in the brain and the spinal cord. This is not unique to MS, but certainly people with MS they are more likely to experience neurologic fatigue. And then there's all kinds of other secondary reasons why someone can experience fatigue. Muscle spasms alone can be very fatiguing, right? So as your muscles are contracting uncontrollably, that's in many ways spending energy, and that can be very fatiguing. Heat is another source of fatigue, and speaking back to Stephanie's comment about the hot bath technique, if someone responded very poorly to a heat stimulus, particularly with fatigue, that was one of the indicators. The tricky thing about activity is that both too much and too little activity can be significant sources of fatigue. And then there's a whole host of emotional factors. You don't have to have a history of depression or anxiety to have significant emotional symptoms in MS that can also impact your fatigue. Just being under stress can also be a huge trigger for fatigue. And if we look around us in this day and age, in this time, particularly with COVID happening, a lot of us are under stress, and that can definitely be increasing the fatigue symptoms. We'll talk about that a little bit more as we go through. Sleep disturbance can also be a cause of fatigue. And in terms of if you are experiencing insomnia or some of the sleep disorders that we'll talk about today, those can also exacerbate fatigue, understandably, if you're not getting good quality sleep. And then finally on this slide, we talk about medication side effects. As a psychologist, I don't prescribe medication. I don't make recommendations in terms of what medication someone should or should not be on, but we do know that some medication side effects can at times increase fatigue. And I know, Stephanie, you had some thoughts and comments on this as well.
Yes, some examples that you all might be able to relate to could be when weakness impacts your ability to move in bed and you have to wake up in order to change positions. And also for the females out there, if you've hit menopause, that can impact your fatigue and ability to sleep at night as well.
Absolutely. So thank you for that, Stephanie. There's another concept related to fatigue, and this is the term known as lassitude. Lassitude often occurs in people living with MS, and it's a form of extreme fatigue. It can occur even after a restful night's sleep. So while over 60% of you reported having significant sleep disturbance more than half of the time, even those of you who don't have sleep problems may still be experiencing this pretty persistent daily fatigue that may get worse throughout the day. It's likely to interfere with daily responsibilities, or it can at times prevent you from doing things that you want to do. Much like the fatigue I described on the previous slide, this lassitude can also be aggravated by heat and humidity. And there's some preliminary research that is showing that fatigue versus lassitude are independent constructs or independent variables. That the way that people describe lassitude is qualitatively different than any other kind of fatigue that you've ever experienced in life. It's not like the fatigue you get after a workout or when you don't sleep well. It's this, again, that neurologic fatigue.
And I'm just going to add in there that sometimes it's like when you go to take your shower and you're getting ready to get dressed and go for the day, and after you've gotten out of the shower, it just feels like you've run a half marathon and you were just taking your shower. So before we get to this, how many of you have difficulty explaining your issues with fatigue to the important people in your lives? So, all right, so around 60% of you sometimes to frequently have difficulty explaining your fatigue to the people that are important in your lives. So in those instances, when you're having difficulty, you may want to think about using the spoons metaphor to help out. For those of you who haven't heard of this metaphor, it is a way that you can describe a reduction in your energy reserves to other people as relates to the energy that you have available for activities of daily living and productive tasks that may result from disability or chronic illness. The spoons are a visual representation used as a unit of measure in order to quantify how much energy a person has throughout any given day. Each activity requires a given number of spoons, 1 to get out of bed, 2 to bathe. It depends on the person. You can only replace the spoon or after you've recharged it through rest. A person who runs out of spoons has no choice but to rest until their spoons are replenished. And there are times that we wake up and have fewer spoons to start with than those people who are not living with a chronic illness.
So as we talk about fatigue, it makes sense to also include discussion of sleep, hence why tonight's webinar focuses on these two related symptoms. We're going to talk about some of the common types of sleep problems in MS because there's actually many different kinds of sleep disorders. And for people with MS, you may be more at risk for certain types of sleep disorders. If you can see the image on the slide here, there's a general category of sleep-wake disorders that are divided into multiple subcategories. And if you go around clockwise, beginning at the top, it says insomnia disorder, hypersomnolence disorder, narcolepsy, breathing-related sleep disorders, circadian rhythm sleep-wake disorders, non-REM sleep arousal disorders, nightmares, REM sleep behavior issues, restless leg syndrome, and substance or medication-induced sleep disorders. Now, all of these are probably more common in MS than the general population. And the three that I've highlighted with the stars are insomnia, breathing-related issues, and restless legs. And those are the things that we'll mainly focus on in tonight's. But there's certainly other resources out there through CANDO and through other MS organizations, including the National Sleep Foundation, that talk about these other issues as well. The sleep problems most common in MS deal with not having adequate sleep quantity or quality. And that's a pretty essential piece of being able to manage MS fatigue is having adequate sleep. Over 50% of people with MS do report some kinds of problems with sleep, and that was reflected on today's poll as well, except over 60 of you reported that. We know that sleep disorders are more common in MS than the general population, and it's also common in other neurologic conditions. So the three that I wanted to focus on were insomnia, sleep apnea, and restless legs, since these tend to be the most common in MS. Insomnia is defined as difficulty falling asleep or staying asleep. And I know that some of our attendees may have questions that even if you don't have trouble falling asleep, you may wake up frequently in the night and have difficulty getting back to sleep. And that's very common in people with medical conditions. There's also two different kinds of insomnia. There's acute, which is short-term, often in response to a stressor, including things like COVID. And then there's chronic insomnia, where this persists for a longer period of time. Then there's sleep apnea, which is defined as slowed or pauses in breathing during sleep. And there's two different kinds of sleep apnea that we'll discuss. And then finally, restless legs, which is an irresistible urge to move one's legs. All of these things can interfere with your sleep and then therefore exacerbate your fatigue. With insomnia, as I mentioned before, acute insomnia happens to virtually every single person in the world at some point in their life. It can happen in response to a medical event or a new stressor. You might worry. You might have difficulty falling asleep. This usually lasts for a few days to a few weeks, and often, more often than not, particularly for people without MS, resolves on its own. Now for people with MS, and if you change your behavior because of the acute insomnia in ways that may perpetuate the insomnia, then you're more likely to develop the chronic insomnia, which is defined as being more than 3 nights a week and more than 3 months in duration and has an effect on your daytime functioning. For sleep apnea, again, this is the pauses or slowness in breathing during sleep. It can be caused by one of two things, and there's 2 different types. There's the central sleep apnea, which often occurs in neurologic disorders. If you look at the figure on the slide, you see that the central sleep apnea occurs when brain areas that control your breathing don't function correctly during sleep. So the signals to your lungs that would normally say, hey, breathe, aren't working correctly. Then there's obstructive sleep apnea, and that tends to be where the nerves that are going into the larynx or the throat or the airway become weak or damaged over time, and those muscles start to become weak. And so there's actually a physical obstruction where it's difficult to breathe because of the collapsing or the weakness in those muscles. Symptoms of sleep apnea, regardless of which type, often include waking with dry mouth, snoring, which often has to be observed by a bed partner because we often don't know if we're snoring. And sometimes morning headaches can also be a good indicator that sleep apnea may be something you want an evaluation for. Because oftentimes headaches are caused by a number of different things, but it's unusual to wake up with a headache. And if you wake up with a headache, this could be an indication. And finally, the restless legs. This is different from the spasms or tremors that people with MS often also experience. The spasms and tremors are uncontrolled movements. Restless legs, on the other hand, is this really uncomfortable, irresistible urge to move one's legs because of this uncomfortable sensation. So you purposefully move your legs to get rid of the sensation, and it's almost like the only thing you can do to get rid of that discomfort, it's like an itch that you need to scratch, is to move your legs. And then understandably, you can't sleep because you feel compelled to keep moving your legs, and it's absolutely exhausting. So all 3 of these symptoms, they're not mutually exclusive. People can have more than one sleep disorder, but these are often the ones most commonly reported in MS. So it's probably understandable to think about what the relationship between fatigue and sleep is, right? We've already said that poor sleep is one of the causes of fatigue. But it's also a little bit more complicated than that, right? It becomes more of a chicken and the egg question of which comes first. And again, it depends on the person. So fatigue can result in things like napping during the daytime more, or people may be more likely to use caffeine or stimulant, loading up on the coffee to try to cope with the fatigue, and then you can't sleep at night. Or you may take a stimulant medication for your fatigue that at times, depending on when you take it, could also impact your ability to fall asleep. This can result in a lot of frustration and stress and worry, and then that also interferes with the ability to fall asleep. And then you can't sleep, and so then you're fatigued during the day, and it becomes this vicious cycle.
In this next session, we will discuss the basic tools for assessing fatigue and sleep. The fatigue severity scale can be a useful tool in scoring your fatigue. You answer the questions based on your level of agreement with the 9 statements. Then you divide that number by 9. People with depression alone score about 4.5, but people with fatigue related to MS, lupus, or chronic fatigue syndrome average about 6.5. When I added this up today, my score is a 6.2, so I'm pretty average. You can access this tool in the reference section at the end of this presentation.
In terms of sleep, one of the most common and brief measures you can use is called the Insomnia Severity Index. It's only 7 questions, and it asks to what degree you have different difficulties with falling asleep, staying asleep, or waking too early. And then they also focus on how satisfied or dissatisfied or how impairing your sleep is at times. Generally, if you score above at 11, if your total score exceeds 11 on this measure, you would meet criteria for insomnia. And now there was also a question in the chat box that I wanted to address here. One person asked, what does REM stand for? I went through a series of different sleep disorders. REM is rapid eye movement, and we all go through different stages of sleep at night, and it's important to have both REM and non-REM sleep. And there are certain sleep disorders that affect different types of sleep more or less than others. So in this next section, I'm going to talk about a sleep study, and actually whether you have insomnia or sleep apnea or maybe one of the REM or non-REM disorders, a sleep study can help diagnose that. And again, lots of MS symptoms can also contribute to sleep disturbance. So you may have difficulty falling asleep because of pain. You may have difficulty staying asleep because of bladder issues. There's a lot of overlap between these, and sometimes if you can treat the symptom effectively, the sleep piece may be resolved somewhat. A sleep study is the best way to diagnose sleep apnea, and getting a full evaluation with a sleep medicine specialist is highly recommended for a lot of our patients. A sleep study can often be done either in a clinic, in a sleep medicine clinic, or sometimes at home, depending on your unique circumstances. And as you can see from the image here, in a sleep study, you may be hooked up to various monitors to monitor all different aspects of your sleep. It monitors your brain waves, so what's happening neurologically as you're sleeping. It measures your heart rate. It measures your skin conductance or your sweat. It measures whether you're moving in your sleep when maybe you shouldn't be. We all go through a stage of sleep where we should be paralyzed during our sleep so that we don't act out our dreams. But in some sleep disorders, people do act out their dreams. So all of these things can be diagnosed through a sleep study. And particularly if you have a bed partner who's noticing the snoring or that you're stopping breathing, it's really important to get that sleep study because they can quantify just how much breath you may be losing. And if you think about it, if we're not breathing in our sleep, we're not getting the oxygen to our brain, and then that can result in daytime fatigue and headaches and symptoms of cognitive dysfunction. Okay, so now that we've focused on what fatigue and sleep issues are, we have some strategies for managing both the fatigue and the sleep.
In my work with people who are living with MS, I have each client complete a fatigue diary. By writing down your activities and levels of fatigue that accompanies each activity, you will have a visual representation of your activities and resultant fatigue levels. You're also able to find out what is your best time of day in which to complete certain activities. Knowing this information will help you in prioritizing your activities based on what the activity is, how fatiguing you find that activity, and when you can implement rest breaks. This is an example of a fatigue diary. By keeping a written diary, you can share it with your physician and your family or friends as a way to discuss how your fatigue is impacting your daily activities. You can access this fatigue diary in a section on your screen labeled Files Pod.
Similarly, the other document that was shared with you is a sleep diary. So when I'm working with people with MS and their support partners, I almost always talk about sleep, and a significant proportion of the people I work with, I ask them to keep a sleep diary. This is because, let's take, for example, eating breakfast. Forget sleep for a minute. If I asked you what you had for breakfast this morning, you'd probably be able to tell me. If I asked you what you had yesterday morning, you would probably still remember. If I asked you what you had last Tuesday, that may be more difficult. And our most recent memories are highly likely to bias our overall memory. So if I said, hey, how has your sleep been in the past month, and you've most recently had a poor string of night sleeps, you'll say, wow, it's been really, really bad. So the whole point of keeping a log or journal, whether it be of fatigue or sleep or nutrition, whatever health behavior you may be working on in your individual life, it's important to keep a daily track record of those. And in a sleep diary, it's important to note some specific outcomes. One, we want to know what time you got into bed and what time you actually tried to fall asleep, because these are two different questions. You may get into bed but have no intention of falling asleep at first, right? You might be watching some TV, you might be on your phone, you might be talking to your partner, you might be having sex, you might be doing all kinds of different things that are not intended for sleep. But then we want to know what time you actually tried to fall asleep, and then what time you actually fell asleep. And that's what's called the sleep latency. It's that time between when you really want to fall asleep versus when you actually fall asleep. And for people with MS and other neurologic conditions, that can be a long time, right? I have people saying anything from 5 minutes because they take a medication that, quote, knocks them out, to 3 hours because they're up constantly. We're also interested in how many times you wake up throughout the night and in total how long those wakenings last, because every single one of us wakes up during the night multiple times. We just might not be aware of it and we don't remember it because we easily fall back asleep. But if we're awake and we're really awake for longer than about 10 minutes, we're going to remember it and we're probably going to be frustrated, especially if we're not able to fall back asleep. So that's when I'm asking more questions about how long it takes you to fall back asleep when you do wake up in the middle of the night. And then finally in the morning, I'm interested in what time your final awakening is and then what time you got out of bed. Again, 2 different questions, right? You might wake up at 6, but you might stay in bed till 8 because you're really trying to get extra sleep and you feel really fatigued and you think if I just got 30 more minutes, I would feel so much more refreshed. And we'll talk about the pros and cons of those issues. And then the final item is asking about your overall quality of sleep. I noticed in the chat box someone mentioned, they said, it seems like it doesn't matter how much sleep I get. I could sleep for 8 hours, 9 hours, 10 hours, 12 hours, and I still feel fatigued, or I still feel like my sleep was not good quality. And that's an important thing to note as well.
Another way to decrease fatigue is to work on avoiding heat. You can implement the following activities to decrease the impacts that heat may have on you. These include trying to stay inside when it's hot outside. Like here in New Mexico, in the summertime, the best time to go out for a walk is really early in the morning while it's still a little bit cool, or towards dark when it's starting to get a little bit cooler. You can also have cool snacks such as popsicles, which should only probably be on occasion, or better things like frozen grapes or something like that. In this slide, the lady that's doing yoga on the mat is wearing a thermopyral cooling garment, which is really great to use when you're going to get hot. And then make sure you stay well hydrated. And then if you have air conditioning, turn it up. And if you don't have air conditioning or it's not working well enough, use some fans to circulate the air in the room that you're using, particularly in the kitchen, so that you don't get overheated there.
Yeah, and Stephanie, I'm so glad you mentioned that too, from the fatigue management piece of temperature. You know, right now, especially if you are in quarantine or if you're self-isolating, you're spending a lot more time indoors and in your home than you would have previously. And you may have noticed that certain rooms in your home are much hotter. So I really recommended that people invest in more fans, you know, make sure that that air conditioning is working well. You might even do a test run of it now while, you know, depending on where you're living in the U.S., even though it's not summer yet, we may still be under social distancing and isolation precautions for a while as the temperatures continue to get warmer. And it's better to know now if there's a problem with your AC than later down the line. We can also talk about ways to promote fatigue management and also promote better sleep through how you manage your bedroom. So an ideal bedroom for sleep should be cool, somewhere around 65 degrees. It should be comfortable, and I always ask people, how old is your mattress? Again, mattresses are not meant to be forever, and if it's time to order a new one, this could really make a difference in terms of your comfort level for sleep. How dark is your room? You know, we generally sleep better when we're in a dark environment, and you can get some really good deals on some blackout shades at various outlets right now. We also need quiet. So quiet can mean a few different things. Sometimes people feel that they can't sleep in silence and that they need some kind of noise. A white noise machine would be perfectly acceptable for that. For people who grew up in urban environments, in cities, you're used to hearing cars and sirens and all that background noise. It's totally okay to have a white noise machine that can help mimic that or provide some sound but not disrupt your sleep. The key thing is to have it be more white noise that's a constant repetitive noise or to keep it quiet altogether. But that's kind of the ideal healthy sleep environment. One of the questions was regarding if certain types of mattresses can help people with MS sleep. There have been no clinical trials looking at specific types of mattresses. Again, there is an individual comfort level to this. One thing I will say though is that if you do have sleep apnea and you find that it's harder to breathe when you're lying on your back, or if your pain is more severe when you're lying on your back, sometimes sleeping in a somewhat propped position can be less painful or more comfortable in that regard. And again, you could have a really fancy mattress that does the propping for you, or you could get some firm pillows to do it yourself as well.
So in this slide, I want to talk about how they have found that research supports that people living with MS can benefit from regular exercise, which can also have an impact on your fatigue levels. As Abby said earlier, you don't want to do too much, but you don't want to do too little. So you've got to figure out that right amount. But it is really important to be doing exercise. These pictures demonstrate gentle exercises like Tai Chi, seated yoga, and water aerobics. The National MS Society has also completed studies on the use of high-intensity interval training and the use of functional activities as exercise and their benefits for people living with MS.
Sure.
So,
and before we talk, sorry, I wanted to address one question that came up before we talk about the healthcare team, because this actually relates to healthcare information, because we share a lot of information with our healthcare team. Someone had asked about a Fitbit and comparing the Fitbit to something like a sleep diary. Really good question, and research continues to support that what we report as our sleep is often not correlated or not strongly associated with what is actually happening in a sleep study. So as a psychologist, I'm more interested in people's perception of their sleep as opposed to what their actual sleep is. Because to some degree, if I showed you on a sleep study that you're sleeping 8 hours, but you're still fatigued, it doesn't really matter what the actual sleep study says or what the Fitbit says. The fact is you're still tired and you're dissatisfied with your sleep. So I work around more of those perceptions of sleep. If it felt like you were only sleeping 4 hours, well, there's an intervention to work through that. Sorry, Stephanie, but I just want to jump in on that one.
Okay, that makes perfect sense. It's important to really work with your healthcare team. Know who they are, form a team. They're there to help support you. Now, I know that it can be difficult to get to appointments with healthcare providers, but it's really important that you make those appointments and keep them. There are alternative ways to reach some providers, including accessing professionals who offer telehealth services where and when appropriate. An OT or PT can work with you on setting up appointments at a frequency of 1 time a week or every other week, whatever best fits your needs. And an OT and PT can also help you get started on a personalized home exercise program. It should also be noted that there are ongoing studies that are addressing the impact of talk therapy or cognitive behavioral therapy on insomnia and fatigue. This slide demonstrates the aspects of health that impact your overall wellness. They include work and home, emotional well-being, spirituality, cognitive well-being, diet, exercise and health behaviors, and relationships. You should also work on managing your other medical conditions in order to stay healthy. It should be pointed out that utilizing stress management techniques and relaxation techniques can have a really positive impact on your fatigue levels.
Just to follow up on the wellness, yeah, so for the wellness, this is a great image that I tend to emphasize for folks when they come to me, that we can't do everything all the time, right? So this image is a great way of showing kind of the 6 dimensions of wellness that the Can-Do team and the National MS Society really look to promote overall wellness. And when I do multi-week interventions with patients, we may focus on 1 or 2 weeks on each of these items and set realistic, specific goals for each of them. But when you look at it, as it is right now, it can be really overwhelming. And so I really encourage people to start small or focus on one or two of these that really stand out for you of what's most important to you at this time.
Great. Now we're going to talk about the 4 P's of energy conservation. This is another way to work on managing your fatigue by implementing these, and they include prioritizing, planning, pacing, and positioning. And the next slides will go into more depth of what these strategies include.
Let's talk a little bit about prioritizing activities. The beauty about priorities is that they're yours. They're your values and your priorities. And it can be really hard to figure out what's most important at times, especially if you feel like you're being pulled in multiple directions. Again, right now for people working from home, parenting, managing your healthcare, people are feeling fried. And doing activities of prioritizing, even something starting at the beginning of the day, can be really helpful for this. It can set the tone for the day and actually help you manage your fatigue because you set those limits through prioritizing. So let's say it's the weekend and you really want to clean your office and clean your guest bedroom. Which one takes priority, right? How do you decide? And do you have other activities that you want to do on a Saturday? So what impact will these other activities affect you earlier in the day versus later in the day? Sometimes it's helpful to create a grid for yourself like you see on the slide here, where you divide things into whether they are urgent versus not urgent and important versus not important. And I've even had this up on my fridge at times where, you know, you can write what's in the boxes at various times, and it can be a way of communicating to family members where your priorities are, right? So, and there may be different priorities among different family members, and you can work to negotiate that. But it gives you this nice visual representation of if something is not urgent and it's not important, it's probably not going to get done today. It might not even get done this week, and that's completely okay. There's probably things that are really important to you that aren't urgent, and you have to hit the urgent things first, but that doesn't mean that the important things should always take a back seat. So that can also be the conversations with a partner, with a friend of, I really want to make this happen. This thing is really important to me. How do I make sure I make space for that in my life so that when these urgent things pop up, it doesn't completely sideline these other important goals that I have?
And I think that this urgent, non-urgent, important, not important grid can help you make it so that if you were to make the to-do list on the left, you could come up with 20 things that you want to get done that week and get really overwhelmed and just not getting it done. But with using the grid, it can help make that easier.
The second P of the 4 Ps is planning your activities. So once you start with that prioritizing, it makes planning a lot easier because it gives you a sense of what direction you need to go first. So you can decide what the best time of day is to do a certain task. You can try alternating some of the more, the easier versus the more complicated tasks, and that can also be helpful. And then in terms of your planning, also make sure that the rest breaks are also part of your planning activities. I think I saw one of the earlier questions in the slides. They were asking whether doing meditation throughout the day could help substitute for poor nights of sleep. And the answer is both yes and no. You can really help cope with fatigue, and you can probably help improve your sleep overall by taking deliberate rests or breaks throughout the day. Not naps, but breaks. And then that may actually help you with your sleep on the back end. It doesn't replace your sleep, though, because a rest is not the same thing as going through your required sleep cycles throughout the night, and we all go through several sleep cycles throughout the night.
So in our lives before MS, we could run a quick errand, do a lot of things around the house, juggle work and community activities with really little or no real problems. Now, it's really important to think about the pace that we need to use to complete those same activities. Because where we used to just steamroll through it, if we take a slower pace and work on the slow and steady winning the race, you'll get stuff done easier, and you may even enjoy your surroundings a little bit while you're doing it. Just remember that it's easy to use your prior level of functioning as a baseline when you set your pace, and that doesn't work because you can't complete things the way that you used to. And sometimes in our heads we still think that we can, and our body likes to tell us that we can't.
Great point. And one of the attendees mentioned that in that quadrant of urgent and importance, that quadrant 3 where something is urgent but not important is sometimes referred to as the tyranny of urgent. And this can also be a way of pacing your activities, that if something is coming up and it feels very urgent but it's not very important, that doesn't mean that you have to do it right then. You can really empower yourself and set boundaries with other people by saying that's really not the priority right now, and dedicate that time to something that is more advantageous for you throughout the day, including the pacing.
Great comment, Abby. So the next thing we want to talk about is watching your position during activities. When you go to perform the activities that you have decided that you need to complete that day, think about what position is required to perform each activity. Try to set it up so that you can sit to perform the activity, or at least alternate between sitting and standing. Sitting requires 25% less energy than standing to perform the same activity. The chair, the white chair that you see in the picture, is a kitchen chair, so that while you're at the stove, you can sit on that and stir, versus having to stand, because that standing just takes a lot more energy. Another helpful technique while you're doing your activities is to keep your cleaning supplies in each bathroom and your kitchen, so you don't have to carry them around with you. And then another technique that you can implement while watching your position is to use lightweight cleaning tools to complete your cleaning tasks. For example, when I'm at work, I use my manual wheelchair so that I can reduce my fatigue levels. And then at home, when I'm dusting, I use my electric scooter and a long-handled Swiffer to get the job done with less effort. Oops.
We have a polling question here asking how many of you implement energy conservation techniques in your daily activities?
And
just waiting for a few responses to come through here.
yeah. So it looks like about 35% of you implement them sometimes, like 26 to 50%. And I know that it takes thought to start using the energy conservation techniques, but I can tell you from experience that it really can help you be able to get done what you want and need to get done during the day.
So then on the sleep front, many of you have probably heard the term sleep hygiene before. And sleep hygiene is part of a series of different kinds of techniques that you can use to help improve your sleep. The keys of sleep hygiene include keeping a consistent sleep and wake time, which is incredibly difficult when we have busy and unpredictable lives. But there may be some more room for creating that consistent time than you may realize. And actually, sometimes one of the best ways of keeping a consistent bedtime is actually putting your bedtime later than you normally would ideally want to be in bed. The reason being, which I'll go into very briefly, is that the more tired you are, the more likely you are to be able to fall asleep, and then you're more likely to stay asleep and have good quality sleep. Now, that doesn't mean staying up all night, but if it means that, let's say some days you can get into bed at 8 p.m. and other days your kids are up doing homework, or your spouse is up, or there's any number of reasons why you can't get into bed until 10. Well, maybe 10 p.m. should be your bedtime, even if there's some days where you could get into bed earlier. Using your bedroom only for sleep and sex is important as well. it helps train the brain that bed is meant for sleep. The more we do other types of activities in bed, the more the brain thinks, oh, I'm excited, I can do these other things. I can go on my phone, I can watch TV, I can read a book, I can have all these other sources of enjoyment. And we want to train the brain that, nope, as soon as your head hits the pillow, that's a cue for your body to start relaxing and getting ready for sleep. Some other things that you can see on the slide here focus on avoiding large meals, particularly very carbohydrate-rich meals that can disrupt sleep. Certainly avoiding caffeine before bed. And actually, I don't know how many people realize this, but caffeine tends to stay in the system for about 8 hours. It has a very long half-life. So even though you may have had your cup of coffee 4 hours ago and you don't feel the effects of it, it can still have significant effects on your ability to fall asleep. And so that's why we recommend cutting off any kind of caffeine at least 8 hours before bedtime. And then another technique, which I think came up in one of the questions, is if you're waking frequently during the night and you can't get back to sleep, it's important to get out of bed and do a quiet activity. And then maybe after 15, 20 minutes when you start to feel sleepy again, then try to get back into bed and reinitiate your sleep. Again, this gets back into training your brain to associate your bed with sleep. And actually getting out of bed, as much as we don't want to do that and as frustrated as we are when we can't sleep sometimes, it's that getting out of bed and doing something and then getting back into bed that sort of resets the system. Another huge important piece of this is taking care of your mental health. Now more than ever, when stress is running high and there can be all kinds of different causes for anxiety, depression, insomnia, untreated depression can also affect fatigue and sleep, as can untreated anxiety. The National MS Society's website has a wonderful tool for finding mental health practitioners in your area. You can search by zip code and use, within a certain radius to find a mental health provider. And currently now, many providers are offering telehealth services across state lines and across geographic distances that were previously not possible. So definitely ask your neurologist, ask your healthcare providers, ask your insurance company about telehealth options, because that has this, in many ways, one positive thing coming out of COVID has been reduction of barriers for people getting care. You might also check out some of these online platforms here in the slides that will be available to you.
So if you just look at that picture on the left-hand side, it's really overwhelming looking at all that stuff. If you can really declutter your life and make it more like the picture on the right, it's going to make your life easier. It also makes it safer, because if that's what's on the desk, imagine what's on the floor. So you want to make sure that your walkways are clear, and by decluttering you can make that easier so it reduces your risk of falls. By decluttering, it also makes locating items more cognitively and or visually easier. If you want to learn more about decluttering, there's an article in the spring 2020 edition of the Momentum magazine published by the National MS Society that addresses decluttering in more depth. It really is okay to ask for help when you're completing your activities in order to decrease your fatigue level. By asking for help, you're really managing your self-care. The National MS Society website and the MS Foundation websites both have resources to assist you in finding help in your community.
And you're already doing a lot for yourself, just even by attending tonight's webinar and even looking through the Can Do webinar archives and the articles for different tips and tricks. So Can Do MS has their webinar programs, their Jumpstart programs, their in-person programs, all different opportunities for learning more and sharing that with your support partners.
And the reading articles. So most of all, be kind to yourself. Don't berate yourself or get frustrated with yourself because of your fatigue and how it impacts your participation in activities. This quote by Michael J. Fox is one of my favorites. Acceptance doesn't mean resignation. It means understanding that something is what it is and there's got to be a way through it. I keep this at my desk at work so that I can share it with all my clients. and also just as a reminder to me that we're going to get through this. Just means figuring it out how.
Absolutely. A question came through specifically asking about the getting out of bed piece of, why is it important to get out of bed when you can't sleep if you're able to fall asleep by, for example, listening to an audiobook or doing something else. This often comes up for people with mobility concerns, right? It may not be possible for safety reasons to get out of bed when you can't sleep. And so for every suggestion or point of advice here, I do also want to add the caveat that there are individual factors, right? Every person's a little bit different. And these suggestions are more for folks who are having trouble with sleep, right? So if you're able to fall asleep listening to an audiobook within a few minutes and that works for you, great. It's not a problem. I wouldn't probably see you in my office because you're not having a problem. So it's more the folks that have tried X, tried Y, and it's still not working. That's when we try something that's a more structured regimen that may seem overly structured, that may seem overly difficult. And the point is to, again, retrain the brain, and then we can start to expand from there. So I definitely don't want to discourage people from doing things if it's working for you. It's more that if things are not working, this is a great time to explore working with a psychologist, an occupational therapist, a physical therapist who can help troubleshoot some of these issues as they come up.
Awesome. Thank you, ladies.
On the questions, there were several questions about the cooling vest. And that particular picture was of a vest made by a company called Therm Apparel. I like that particular brand because it's something that you can wear under a shirt so that it doesn't look like a vest that you might wear, that you have to wear over top of your clothes. But you can also look on the MS Foundation. They have a cooling accessories program that you answer a few questions, and if you meet the criteria, they'll send you a cooling vest. So that now's a really good time to get that ready for this summer.
I love it. So before we jump into more Q&A, I just did want to note, I want to remind all the participants that we'll ask you to complete a survey at the end of the webinar tonight. It'll pop up on your screen at the end. So we just ask that you complete that so we can continue to improve all of our programs. But we had a number of great questions come through, and I know that both Abby and Stephanie have addressed some of them. One I wanted to jump on really quick because we were kind of just talking about it. The quiet activities at night. If you wake up in the middle of the night, what are some suggestions for those quiet activities?
Sure, great question. So the short answer is doing anything that's not going to be overly stimulating. So things that's not going to get your heart pumping, something that's not going to be overly stressful or getting your mind going or worrying. So folding laundry, maybe doing a little bit of meal prep, doing some kind of activity that's not super burdensome. You could do reading, right? You could go into a different room and have a separate chair that's your reading chair, and that's a quiet activity. You could even watch TV. There used to be this pretty hard and fast rule that say, no, like TV is the worst because of the blue light and it's going to screw up your sleep. Some of the evidence suggests that that may not be as severe of a problem as we once thought. What would be more of a problem is if you went and you were watching a really loud, invigorating action movie or a really scary movie that has your emotions running. You can go watch something really boring, right? Go listen to a really monotonous radio program or TV program or something lower key that's pleasant, enjoyable, but not really stimulating.
And then what about falling asleep while reading a book?
In general, like I said before, if part of your bedtime routine is reading and you're able to fall asleep within, a reasonable time of that and you're not having severe insomnia symptoms of waking through the night or waking early, then there's really no problem. It's really when folks are taking longer than an hour or even longer than 30 minutes to fall asleep, and sometimes the book can be a barrier to that. So it may be helpful to work on some other relaxation strategies that you could try without the book. But again, if you're falling asleep with the book, then to some degree that problem is solved.
Now, is it helpful or harmful to take sleeping medications occasionally to get better sleep?
Great question. I saw a few questions pop up regarding medications. And Stephanie, I'd love to hear your thoughts on this too, given that neither of us are physicians. So we do not make recommendations for medication. That being said, one thing I will say is that when it comes to insomnia, the American College of Physicians recommends cognitive behavioral therapy for insomnia, or non-pharmacological management of insomnia prior to trying any medication. And the reason they make that recommendation is that behavioral interventions are incredibly effective for insomnia. They're often the first line of, they are recommended as the first line of treatment. And that's also because the sleep medications that have been developed in many ways were discovered on accident, right? So they were developed for something else, and they found that people were falling asleep to them. So then they were using them as sleep medications. Now you may require a sleep medication based on your health concerns, based on your relationship with your provider, and definitely ask your medical prescriber before making any changes in your medical regimen. But in general, sleep medications help people fall asleep. They may not keep people asleep, and the quality of the sleep may not be as great. So those are the pros and cons when you're thinking about sleep medications.
Haven't you hit it all with that?
Perfect. And then a lot of participants also brought up restless leg syndrome. I wonder if we could circle back and touch on that again, what the options are for that symptom.
Sure. So typically you can talk to your neurologist about if there are certain medications that may be helpful for managing restless legs that don't interact with your other medications. From a behavioral standpoint, as a psychologist, what I will often do is I'll work with people in the office to work on tolerating some of that intense discomfort, right? So in the same way we might work with panic or with pain or with other really very physical sensations, helping reduce the stress and the distress that comes with those physical sensations. So we may not be able to take away the fact that you have the restless leg sensation, but through psychotherapy, it can actually reduce the intensity of that negative sensation and can help you manage the sensations a little bit better.
Another question that came up a few times, do you have any recommendations for people who are up several nights to use the restroom?
Really work on limiting your fluid intake, particularly the caffeine and the alcohol, because both of those are going to make you have to get up and go to the bathroom more frequently. I really try and make sure that if I'm going to have caffeine, it's first thing in the morning and not past 9 o'clock, so that I don't have that caffeine in there. If you are having issues with bladder issues at night, you may want to get a referral to a urologist and have them talk to you. You can, because there are a variety of different things that can be done to help with that issue. There are bladder diets that you can use to make it so that you're not as urgently needing to go to the bathroom. They're using some different drugs and that kind of thing. So it's something to really talk to your providers about.
Yeah, and there are urologists who specialize in neurologic conditions. They're called neurourologists. Right. They can be really great resources, not only for medications, but also procedures. So Botox has been used for bladder issues that can also help with the nocturia, or the nighttime bladder spasticity. Another thing you might consider is seeing a pelvic floor specialist. This is typically a physical therapist who specializes in the pelvic floor muscles and helps strengthen the muscles that surround bowel and bladder. functioning. So increasing the endurance and the strength of those muscles can also help prolong how long you can go in between going to the restroom. Another piece to that is depending on how often you're getting up to go to the bathroom, if it's 3 or 4 times a night and you're able to get back to sleep pretty easily, that would probably be less of a problem than if you're getting up more frequently and if you're getting up and then you can't go back to sleep. So again, if let's say you got up 4 times, you got up for 5 minutes each, you're really not losing a ton of sleep. You would lose about 20 minutes of sleep throughout the whole night, and that's probably not going to interfere with your functioning as much as if you are up longer and then you're frustrated because you can't get back to sleep. So that combination of seeing a urologist or a neurourologist, considering the potential medications and procedures, and then some of these behavioral factors like diet, fluid management, and how much time of sleep you're actually using, you're actually losing to the problem.
Now the next question is very pertinent to this current situation that we are all living in. We have been self-quarantined since mid-March. No COVID-19 diagnosis, but I am tired a lot and find it hard to sleep well. Any suggestions?
So I know, Stephanie, you and I probably both have different thoughts on this from a self-quarantining perspective. Not different thoughts, but additive thoughts, I should say. In so many ways, MS is such an unpredictable disease, right? Fatigue is already something that's so common, and fatigue is unpredictable, right? It can worsen from day to day. It can worsen even within a single day. And so when it comes to COVID-19 specific symptoms, which you can find on the CDC website, on the National MS Society website, these are 2 very trusted resources, you'd want to look at not just the fatigue, right, because fatigue is common to MS, the flu, the common cold, coronavirus, other chronic health conditions. You would want to make sure that there's not other symptoms like the fever piece, right? The coughing piece, the difficulty breathing piece, all of those that are much more diagnostic of COVID compared to the fatigue by itself. That being said, keeping that journal that we discussed can also be helpful for recognizing patterns. And if you're having severe worsening of fatigue along with some of those other symptoms, definitely call in for a screening.
And there are different resources available online that you can just check your symptoms with, and then they'll tell you whether you need to go ahead and go in and get screened. And then there are other people that say, well, I'm used to kind of having to self-quarantine because of the medications that I'm on. So different people have different ways of reacting to the coronavirus.
And another related question, being trapped indoors all the time and not being able to get outside for walks as much, and that activity in that way, fatigue has gotten worse. Any suggestions to help lessen the fatigue?
If you can't get outside to exercise, try some gentle stretching in your house, or using a resistance band. Things that you might not be able to, or you might not do when you can get out, but just some exercises in the home can help with that fatigue level.
Yeah, it's a great point. If you previously belonged to a gym, those gyms very much still want your membership dues, and they're really trying a lot of things to keep people engaged. They're posting Facebook workouts, other social media, YouTube workouts. There's through the MS Society and other MS groups, there are exercise videos that are both live and pre-recorded to participate in for all levels of ability. Again, from light stretching, chair-based yoga to high-intensity interval training. You can really find, if you can think of it, you can probably find something like a video to guide you through, and of all different durations, from 2 minutes to 2 hours.
Yeah, it's amazing how different companies are coming around to help out with that.
It truly is. It seems like we have got a lot of great resources considering. One last question that I had, and let's see. Would you recommend napping?
Great question. There were two questions related to napping, and I'm so glad you asked that. In general, if I'm doing a formal treatment with someone, we generally try to avoid napping as much as possible. The reason for that is that we want to keep up your sleep drive throughout the day so that by the time you get to be at bedtime, you're so tired that you'll be able to sleep. Hopefully you can still hear me. I just lost an internet connection. But again, for people with MS, you may need a brief nap during the day, something along the lines of 20 to 30 minutes. I would not extend it beyond that period, particularly because it can interfere with your sleep on the back end. And the other suggestion I make is that if you do take a 20 or 30-minute nap, set your bedtime to be 20 or 30 minutes later. So it's kind of like, you know, you pay for what you take, right? If you take 30 minutes in the day, you push off your bedtime 30 more minutes. I hope you got all that. My video cut out, but hopefully my audio stayed on.
We still hear you. Thank you, Abby.
Great.
Something that I do, I have a recliner that's my chair, and I go into that and just kick my feet up for 10, 15 minutes, sometimes 20, just to help reduce that level of fatigue, because having my feet up elevated makes it feel like I'm getting better rest than if I'm just sitting in a chair.
Well, thank both of you ladies for that great Q&A session. I feel like we got to a great number of questions tonight throughout the presentation and at the end here.
Absolutely. One more thing about the napping. Sorry, Krista.
No, you're
again,
fine.
Going back to that same rule of thumb, that if you're doing something that works well for you, don't stop it. If that means taking a 30-minute nap on your lunch break to get you through the day, to get you through that afternoon slump that we all feel, and especially people with MS feel in the afternoon, that's an effective tool for fatigue management. And again, like I said, you can counter that by delaying your bedtime a little bit if you're not able to fall asleep. I just want to make sure I address that question from the audience.
Perfect. Thank you. So I just wanted to share a few additional resources that you may find informative and helpful. On the Can Do MS website, you'll find a plethora of archived webinars, e-news, library articles, podcasts. You can also submit a question to the Ask the Can Do team. So if we didn't get to your question tonight, pop over to our website and go to the Q&A section of our website, and we can absolutely get your question answered there. I would also like to highlight some resources available from the National MS Society. They have a variety of brochures and video segments, also specifically on fatigue and sleep, and those can be accessed on their website, nationalmssociety.org. You can also contact their MS Navigator at 1-800-344-4867. If you found this webinar to be of value, please consider donating to Can Do MS or the National MS Society. How can you help Can Do MS continue to provide educational programs at no cost? Join the Kick MS Squad. Kick MS is our peer-to-peer fundraising platform, and it's super easy to get started. You can raise money for programs just like the program you attended today. You can ask for donations instead of gifts for your birthday, make a fundraiser. Really, the possibilities are endless. Visit cando-ms.org/kickms to get started. Another great resource is MS Path to Care, which is an initiative with content created by Can Do MS, focusing on shared decision-making in healthcare experiences, as well as overall health and wellness. Please visit the Path to Care website at www.mspath2care.com. The next presentation in our webinar series will be on Tuesday, May 12th at the same time, 8 p.m. Eastern Time. The topic is employment. So we hope to see you all there. And again, just take a moment to please complete our survey this evening.